Welcome to today's MedFacts. We talk about a bacterium that used to be one of the leading killers of young children before vaccines changed everything. Haemophilus influenzae type B, or simply HIB. HIB is a tiny bacterium that used to live in the nose and throat of humans. Usually it stays quietly without causing any problems. But sometimes, specifically in children under 5 years or in people with reduced immunity, it invades deeper into the body. When that happens, HIB can cause life-threatening diseases by entering the bloodstream, and this carries the bacterium to any other organ to then cause diseases like meningitis, bone and joint infections, or it may cause a frightening throat infection called epiglottitis, which blocks the airways. Before vaccines existed, HIB was one of the most common causes of serious bacterial infection in children under 5. Around the world, it caused millions of severe cases and hundreds of thousands of deaths each year. Even survivors of HIB meningitis often suffered from hearing loss or learning difficulties. The bacterium spreads through droplets when an infected person coughs or sneezes. Good hygiene helps. But vaccination was the true game changer. Since the 1990s, HIB vaccines have been introduced into childhood immunization programs worldwide, and they've reduced severe HIB disease by about 90% in vaccinated regions. Usually, infants receive 2 doses in the first 6 months of life and a booster in the second year. In many countries, HIB protection comes as part of combination vaccine, given as one shot together with vaccines against diphtheria, tetanus, whooping cough, hepatitis B, and/or polio. These combination vaccines are extremely safe and well tolerated. Thanks to them, devastating infections like HIB meningitis are now rare in most countries. But where vaccination remains low, especially in poorer regions, children remain at risk. So if you're a parent or caregiver, make sure infants complete their HIB series on time. It's a simple act that prevents disability and saves lives, proof of how modern vaccines turn deadly diseases into history.